As with any procedure, there is a right way and a wrong way to go about aseptic compounding. Let's look at some important procedures for making sure you're doing things properly.
Prior to compounding, there are a few steps that need to be taken in order to ensure and maintain a sterile environment, such as garbing, hand hygiene procedures, and cleaning and disinfecting. Now, this may surprise you, but the dirtiest thing in the clean room is you. Since we shed millions of particles every minute from our skin and clothes, garbing is absolutely necessary when compounding sterile preparations. Gowns should be lint-free and have a closed front and long sleeves with tight cuffs. Gloves should be put on after gowning and worn over cuffs to create a protective seal around the wrists. Once a gown is worn outside the clean room, it must be discarded. Shoe covers, head nets, and if necessary, beard covers must be donned.
Before entering the compounding area, you will need to tie back loose hair, remove all makeup, jewelry, visible piercings, and artificial nails. Don a hairnet, then beard cover if necessary, then face mask. An eye shield is required when working with irritants like germicidal disinfecting agents. Observe yourself in a mirror to ensure no skin or hair is exposed and no rips or holes are present in your gowning materials.
Raise 1 foot off the ground, place a shoe cover over this foot, and place the covered foot down on the clean side of the line of demarcation in the anteroom. Raise your other foot off the ground, place a shoe cover over this foot, and place the second foot down on the clean side of the line of demarcation in the anteroom. Materials touching the floor of the clean side of the anteroom must not cross back over the line of demarcation.
Perform hand hygiene by first scrubbing nails in warm water and then vigorously washing hands and arms up to the elbows for at least 30 seconds in a hands-free sink. Dry hands with either a lint-free disposable towel or an electric hand dryer.
Don a non-shedding gown that fits snugly on wrists.
Disinfect hands again with a suitable agent, allowing hands to dry thoroughly before donning gloves.
Disinfect gloves with a suitable agent.
And finally, observe yourself in a mirror to ensure no skin or hair is exposed and there are no rips or holes in your gowning materials. Now you are ready to enter the clean room.
Disinfecting the hood is the last step before compounding. Use 70% isopropyl alcohol and lint-free fabric. Place the lint-free wipes inside the hood. Pour the alcohol over the stack of wipes, making sure to saturate them thoroughly. First, wipe the horizontal bar. Then wipe the surfaces in the following order, starting at the top. Wipe the sides back to front. On the flat work surface, start at the back of the hood and wipe side to side while moving forward using long side-to-side strokes. Hood surfaces need to be cleaned and disinfected frequently, including at the beginning of each work shift, before each batch preparation is started, and every 30 minutes during continuous compounding periods of individual CSPs. This is particularly important when there are spills and when surface contamination is known or suspected from procedural breaches. Be sure to document your cleaning activity with the appropriate form. Remember, do not wipe or spray the HEPA filter.
When setting up syringes and other items needed to compound in the hood, always remember, placement of these items should not obstruct the flow of the HEPA filtered air. Specifically, large items should never be placed at the back of the hood because they would disrupt the airflow to the objects in front of them. When stacking items, place shorter ones in back. Because the air inside a hood moves horizontally from the back to the front, place items in a straight line from left to right. Items should be at least 3 inches away from the back of the hood with 6 inches between each item. And remember, work within at least 6 inches from the outside edge of the hood to avoid the area where the hood air comes in contact with outside air.
The optimal area for compounding within the hood is known as the Direct Compounding Area, or DCA. Before placing the supplies in the hood, each article must be decontaminated by wiping or spraying the outer surface with 70% isopropyl alcohol. Wrappers can be removed at the inside edge of the hood or DCA. Avoid introducing contamination and unnecessary clutter throughout the compounding process. Avoid squirting or spraying, and always aim syringes away from the filter. Now you're ready to begin work within the DCA. Vials most often contain medication in either powder or liquid form and are sealed by a rubber closure covered with a plastic flip-off top or protective band. When preparing to withdraw fluid from a vial, the flip cap or protective band must be removed and the rubber closure swabbed with sterile alcohol and allowed to dry. Only then should a needle be inserted to remove the vial's contents. Vials are considered a closed system container because air cannot flow freely in and out. For example, if you add air into the system, the vial becomes pressurized, and pressure can cause leaking or spraying of medication. On the other hand, removing too much air could create a vacuum and make it impossible to remove any of the vial's contents. So when using a syringe, pull the plunger back to only slightly less than the amount needed from the vial.
When using syringes to withdraw medication, be sure to use the right size syringe. Syringes should not be filled to capacity, and the total volume being measured must be at least 20% of the total size of the syringe in order to maintain measurement accuracy. For example, draw up 3.5 milliliters in a 5 milliliter syringe. Begin the withdrawal process by removing the needle cap and positioning the needle bevel up in the center of the stopper. Insert the needle from the side at a slight angle and push air into the vial. Pull back the stopper and withdraw the desired quantity, being careful not to touch the syringe tip or plunger.
One thing to watch out for is coring, small particles of rubber closure that have been carried into the drug solution. Coring can be avoided by always inserting the needle bevel side up and slightly from the side of the vial. Never stab the needle straight down into the rubber.
Once a medication is drawn into a syringe, it can be transferred to a bag through a medication port. Ports are usually made of rubber and act a lot like a vial's rubber closure. In order to transfer the medication from the syringe, hold the port in one hand without compromising the airflow in the hood. Inject the medication into the bag and seal. Mix the contents of the bag by turning it back and forth. Inspect the bag and medication inside for coring or other floating particles, color changes, or leaks. Here's a tip. Slightly squeeze the bag to check that there are no leaks in the bag itself or around the port.
Large volume parenterals, or LVPs, contain 500 milliliters or more. Many different medications may be added to these large volume bags upon physician's orders. Using aseptic technique in the appropriate hood, medication is drawn up into a syringe and injected into the bag through the port.
When intravenous medications are in the form of freeze-dried powder, they must be reconstituted or dissolved in an appropriate diluent or liquid prior to preparation and administration. The powder must be dissolved completely by swirling or shaking the vial. Once the powder is reconstituted, it can be drawn up into a syringe and injected into the port on an IV bag.
Ampules are made of glass and must be broken to release their contents. To open an ampule without spilling the medication or hurting yourself, swab the neck of the ampule with an alcohol swab and allow it to dry. Then hold a clean alcohol swab around the neck and place the head of the ampule between your thumb and index finger of one hand and the body between the thumb and index finger of the other hand. If there's a dot on the neck of the ampule, then you should point that to the side of the hood. The dot indicates a weak point and the ampule should break there. Hold the ampule away from yourself and, using a quick snapping motion, break the neck of the ampule.
Even though you can't see them, there will be tiny particles of glass in the medication, so be sure to use a filter needle when drawing up the medication. To get all of the medication out of the ampule, tilt it 20 degrees and place the needle in the shoulder area of the ampule and well into the fluid to avoid drawing air into the syringe. Continue to tilt the ampule as you withdraw the contents and be sure to maintain a clear path between the HEPA filter and what you are doing. One important thing to remember, although you use the filter needle to draw up the ampule's contents, change to a regular needle before injecting the medication into an IV bag to avoid transferring any unwanted material.
Now, there may be times when you want to filter a non-sterile fluid to create a sterile fluid. Let's take a look at this important procedure. First, use a syringe to draw up the non-sterile fluid. Using proper aseptic technique, uncover one port of the 0.22 micron filter and attach the syringe to it. Then, uncover the other port on the filter and attach the receiving needle or syringe. Begin depressing the syringe filled with the non-sterile fluid, and you'll see the fluid beginning to flow through the filter. Maintain constant pressure on the non-sterile fluid containing syringe until the filtration is complete.